It's very important that we have routine child surveillance to pick up developmental problems. So you have the newborn period when we of course assess the child for any problems. 6 to 8 weeks. I told you yesterday with the growth that we assess the child at 2, 4, 6 months usually with the vaccination. So the similar schedule can follow for vaccines and development and growth as well. And then you should have an assessment of hearing within 6 months. If the screening is not done, you should formally assess the hearing as well. And by 18 to 24 months, a child dental review is important as well. And a formal vision testing should be considered at the preschool age in all children. If you don't have it routinely, you can seek it out. If there is any concern, of course, you have to test the vision earlier. You can see here that's a wide range of normal. So this is the normal range. And then you have the slow but steady progress where they are progressing. These may be the low achievers, or they may catch up to do well later in life. And some children, either because of socioeconomic reasons or bereavement or something like that, they plateau, they don't continue growing, or they might have developed an insult to the brain which affects their brain development. And then you have the regression, which is very rare. So the child develops milestones which they lose. So these are usually very serious and you have to be paying attention to that. You can see here that the gap between the normal and the abnormal becomes wider. So it's easier to pick up abnormality as a child gets older. So by school age, the abnormalities are easier to pick up. However, when they are younger, it's very difficult to pick up the differences. So you may end up worrying the parents for problems which are actually in the normal range, or you may miss problems unless you are looking specifically